So I'm going to talk a bit about long COVID dysautonomia, and in order to explain long COVID dysautonomia, I'm going to explain an aspect of the autonomic nervous system that is crucially involved in the response to any kind of infection, and that is referred to as a vagal anti-inflammatory reflex. So when anybody was exposed to any infection actually, but also COVID-19, this would have activated the vagal anti-inflammatory reflex through signals sent from the site of infection up to the brainstem. Then what happens is the parasympathetic and the sympathetic components of the autonomic nervous system are activated, and they send pro and anti-inflammatory molecules down to the site of infection to contain it. In most people, this does that. It contains the infection and then you get better. When the vagal anti-inflammatory reflex is not working very well, what can happen is that these pro-inflammatory molecules will spill over into the systemic circulation, and this can make people really sick. So when we heard in the news during the pandemic of people warranting management of their COVID-19 in the intensive care unit, it was usually because these pro-inflammatory molecules had spilt over into the systemic circulation and had caused a whole host of problems. Now, thankfully, this didn't happen in the vast majority of people, but I highlight this just to point out that the autonomic nervous system is crucially involved in the response to any kind of infection, so it isn't all that surprising that long COVID symptoms overlap with those of a dysautonomia. Now, I've already mentioned that the autonomic nervous system keeps your system in balance. So the symptoms of a dysautonomia reflect an unbalanced system. And this leads to very non-specific symptoms, and that can lead to a difficulty in diagnosis. So the symptoms that patients will often complain of are things like fatigue, unrefreshing sleep, exercise intolerance. They may have dizziness and lightheadedness on standing up. A lot of people complain of brain fog and poor concentration and headaches. They have generalised aches and pains. They may have gastrointestinal symptoms, and some people will also report a change in their pattern of sweating, and all of these are symptoms of a dysautonomia. Now, what is not fully understood is how this happens in terms of what the virus actually does. It has been postulated that the virus might infect and damage autonomic nerves. It may be because of antibody formation, so you'll have formed an antibody to attack the virus, and sometimes that antibody can get confused and attack the nerves, and this is called an autoantibody. It may be that the virus itself has damaged autonomic centres in the brainstem, but it's just not fully understood at this stage. What also can happen as someone becomes less active because of the symptoms, that then they begin to become deconditioned. While deconditioning is unlikely to be the underlying cause of a long COVID dysautonomia, it certainly contributes.